Okay, let's get started. Welcome to today's webinar on HIPAA Security Rule Compliance 101. This is an introduction to the HIPAA Security Rule and is brought to you by Proactive IT. Today's going to be straightforward and brief. It'll be a little longer than the next webinars in the series just because this is giving an overall summary of the entire rule. Okay, and we are going to be discussing HIPAA security rule compliance. It's very easy to understand the concepts. Even if you knew nothing at all about HIPAA before today, by the time this webinar is over, you're going to be able to put a plan together that will give your organization or your clients a solid strategy to begin complying with the HIPAA security rule. Okay, we're going to break it down into logical steps and give you a roadmap. First, a couple of housekeeping items. If you are attending today live, I encourage you to ask questions. There's a Q&A link on your screen. If you have a question, click it, type your name, type your question, click submit. If you're on a mobile device, if you tap your screen, the Q&A feature should pop up. Do the same thing. If you have any issues with the Q&A feature, please, my contact information is on the last slide. Send me an email and I can answer any questions you have. Okay, let's jump right in. My name is Mark Serqua. I'm a VCIO for Proactive IT. I've been in this business for a little over 10 years and have navigated a range of different technology channels, and I'm really focusing on cybersecurity, information security at the moment. We also have brought the team today. Noel Sutherland, he's the Director of IT and a VCIO for Proactive IT. Noel's been in the business for over 17 years, specializes in cloud migrations. And Keith Foda, company visionary, CEO leading the charge for the company. He's been in the business over 25 years. Keith sits on the CompTIA Advisory Committee, and if you didn't already know, CompTIA is the voice of the world's IT industry, okay? But enough about us. Let's talk about HIPAA and this security rule, all right? Compliance, how is it accomplished? Well, first, let's talk a little bit about what the HIPAA security rule is. So the Health Insurance Portability and Accountability Act of 1996, it's an acronym for HIPAA. HIPAA is an acronym for the Health Insurance Portability and Accountability Act of 1996, excuse me. So this is United States legislation that provides data privacy and security provisions for safeguarding medical information. The Act has 5 sections, and section number 2 directs the Department of Health and Human Services to establish standards for processing electronic healthcare transactions. And it also directs healthcare organizations to implement secure electronic access to health data and remain in compliance with privacy regulations. Now, to understand HIPAA, we need to be aware of 3 important rules, okay? The privacy rule, the security rule, and the omnibus rule. Now, the privacy rule focuses on the right of an individual to control the use of his or her personal health information. The security rule defines the standards for safeguarding protected health information, specifically in electronic form, from unauthorized disclosure, destruction, or loss. And the omnibus rule expands the definition of a business associate and directly regulates business associates and their subcontractors. And we're going to look at what exactly a business associate is shortly. Now, one other relevant item to mention here is the HITECH Act, which basically increased the categories of violations and increased the levels of culpability, this really made HIPAA infractions more stiff, okay? Now, privacy depends in part on security, so those measures overlap a little bit. And today we're going to focus on the security rule specifically. So all covered entities must be in compliance with this security rule, and that happened back in April 20th, 2005. Now, there was an amnesty period, but that's all over with. And you'll hear people saying that HIPAA was the tiger with no teeth, right? Well, now it's grown claws. So if we just look here at ePHI, okay, electronic protected health information, right? This is what's covered under the security rule, right? And we're talking about ensuring the confidentiality and the integrity of electronic medical records, electronic claims, computer databases with treatment history, digital x-rays, email, even paper printouts of electronic information. And there are two groups affected by the HIPAA security rule. One is covered entities. These are healthcare providers, dentists, physicians, nurses, psychologists, pharmacies, you name it, clinical laboratories, all right? Health plans are another covered entity. Your health insurance companies, your HMOs, employer group health plans. Healthcare clearinghouses is another type of covered entity, and healthcare clearinghouses are those organizations that process non-standard health information. Business associates, these are all third-party vendors and business partners that create, receive, maintain, or transmit protected health information on behalf of a covered entity. So we're talking about accountants, lawyers, medical answering services, IT consultants, medical billing companies, medical software companies, record storage companies, medical transcription companies, asset recyclers, medical staffing companies, medical transport, and medical couriers, okay? So these are all different types of business associates, and they're required to comply with this HIPAA security rule, right? Now, let's look at some examples of HIPAA security rule violations that have brought on some very hefty fines. And we're talking about up to $50,000 per record, right? Look at the pie chart. You can see a breakdown of the source data breaches since 2015, okay? The source of data breaches since 2015. We have an emergency clinic lost all of its patient health records when their computers crashed from a virus and they didn't have backups. There was a case of a temporary employee of a rehabilitation clinic who stole patients' personal information, took out fraudulent credit card accounts in people's names. There was a hacker who found a web page on the dark web, which was used by a consulting firm, a business associate, if you will, and that linked to a database of 5,500 records. So do the math, up to $50,000 per record, and you have 5,000 records, that can put an organization out of business. So I know everyone here likes surveys, and there was a recent survey conducted. There's an incredible opportunity for improvement here. So first of all, 95% of healthcare organizations have internet connectivity, right? 25% of that group don't even have a firewall, okay? Not even a basic security device. Another big number is that only 24% of covered entities and business associates actually conduct security awareness programs. So in this day and age, if you or your clients fall into one of these categories, you're highly likely to experience a data breach And with the Omnibus Rule and the HITECH Act in play, you stand a high chance of getting a not so pleasant visit from the Department of Health and Human Services and getting fined for a HIPAA violation. Now, let's get to the good stuff. And there's light at the end of the tunnel. Let's go over this roadmap to getting you and your clients, your organization compliant with this HIPAA security rule. Now, let's make one thing very clear. There's no definitive prescription that can be applied to all companies which would make them HIPAA compliant, okay? With each individual organization, there are going to be different levels of detail and variations which would make it impossible to develop a definitive guide. Now, a covered entity and those business associates can really focus on these overall concepts presented today, and you can tailor an approach to the specific circumstances to their organization. So the 6 bullet points you see here cover the entire security rule, and we're going to summarize each one here today and dig into the specifics. So here it is. Feel free to take notes. I'll be sending out an email to everyone with this slide deck. Okay. The first thing one needs to do when developing a HIPAA security strategy is to perform a HIPAA IT assessment. Okay, this is going to give you a baseline. Going on down to number 2, addressing security safeguards, right? You can see those things broken down into administrative, technical, and physical, all right? Step 3, draft policies and procedures. What you're going to do, how you're going to do it, right? Step 4, risk analysis, right? Determine your risk level. Put in security measures. The implementation, very important, but the testing of that implementation and the continual improvement of that implementation is even more important, okay? So each one of these 6 steps is going to represent a different webinar, right? So we're going to have webinars specifically on the administrative, technical, and physical, the policies and procedures, the risk analysis, the implementation, and how to test, right? So today is a summary of all this stuff, and over the next 7 weeks, we will have a webinar that will touch on each one of these, okay? So let's look at the first step, the network assessment. And let me make a clear distinction here that an assessment is a good thing, right? An audit is a bad thing. So if you're going to do an assessment, we're talking about a proactive approach to determining where you stand with the HIPAA security rule. When audits happen, it typically means something's bad has happened, and so you'll have an auditor come in and they will be comparing what your organization is doing operationally to this HIPAA security rule. But typically, those things don't really go so well. Now, we can break this network assessment down into 3 parts, right? The first one is simply having a business conversation with the business unit stakeholders and leadership. You want to discuss company growth plans, cloud initiatives, infrastructure requirements to support those initiatives. And next, you want to have a walkthrough of your environment at all your locations, okay? Take pictures, note any obvious issues like servers that are located in break rooms, things of that nature, right? Then you need to run a digital network diagnostic, okay? And this can be accomplished through a secure encrypted software tool, right? It'll generate a digital IT infrastructure report for all your network activity, your servers, your desktops, switches, firewalls, software, any and everything on the network will get scanned, vulnerabilities will be detected, and then you will be delivered with a report, okay? Now, addressing security safeguards, this is the second step in your 6-step process to becoming compliant with the HIPAA security rule. Now, you can see that these standards are broken down into administrative, physical, and technical, okay? Each one of these safeguards are going to be discussed in more detail in part 2, part 3, and part 4 of our webinar series, so stay tuned, right? Now, of course, if you require any of this information immediately, please reach out to me. My contact information is going to be on the last slide. We can help you, all right? The third step in your 6-step process is drafting organizational policies and procedures, okay? Now, like I said earlier, there's no definition for policy or procedure, okay? Policies and procedures are going to look different. So if we looked at 10 different companies, we're going to find 10 different policies and procedures. But what's important is that the business policies establish measurable objectives and expectations for the employees, that they assign responsibility for decision-making, and define enforcement and consequences for violations. Procedures are going to describe how the organization is going to carry out that approach, right? Setting forth explicit step-by-step instructions that will implement the organization's policies. Okay, moving right along to the 4th step, risk analysis. One needs to develop a risk analysis strategy and demonstrate risk management. Again, no prescription for a specific type of risk analysis or risk management methodology. And it can be pretty difficult to do this just because of all the different levels of detail and the variations within each covered entity and the business associates, right? But the bottom line here is one needs to create a process of identifying potential risks, and one also needs to make decisions on how to address those security risks associated with the standard. Okay, moving right along to implementation. Now, let's say you've completed an IT assessment, you've fortified all your administrative safeguards, you've created policies and procedures, you've developed a risk analysis strategy and demonstrated risk management, okay? Now you must implement the system and execute. Many of the standards we just reviewed have implementation specification. So an implementation specification, what this is, it's a more detailed prescription of the method or the approach that the covered entity can use to meet a particular standard. But remember, each covered entity, each business associate is going to have a different approach, right? So implementation specifications, these are either addressable or they are required, okay? Let's talk about that a little bit. A required implementation specification, this is a standard that the covered entity must comply with. For example, a risk analysis. All covered entities must execute a risk analysis, period. It's a required standard. It doesn't matter the cost, it doesn't matter the time, it doesn't matter your resources. You have to execute a risk analysis, okay? For an addressable implementation specification, right? This doesn't mean optional, right? What this means is that the covered entity must perform an assessment to determine whether the specification is reasonable and appropriate, okay, to the covered entity's working environment. Once you've performed that assessment, the covered entity or the business associate is going to decide if it will implement the solution, all right, if it will implement an equivalent or alternative solution, or if it will not implement the solution or implement an alternative solution, okay? If the measures aren't reasonable and appropriate, within the network environment, a covered entity or the business associate may choose not to implement that solution, okay? In this case, the decision, right, and all of the information that went into that decision, it's important that that gets documented, okay? So whether you do it or whether you don't do it, you have to document why you made that decision, okay? So for example, all covered entities, including small providers, need to determine if encryption is a reasonable and appropriate standard for their environment, right? This may or may not work for everybody. It doesn't mean it's optional. It means that one must have an assessment done to see if encryption is going to be reasonable and appropriate. You decide if you can do it, you decide if you can't do it, and then you document that decision. So factors that go into what is reasonable and what is appropriate include cost, it includes size, technical infrastructure, and resources. Cost is one factor entities must consider, but it's not the only thing, okay? And just because something is very expensive, it doesn't necessarily free a covered entity from that standard, right? In certain cases, the standard must be implemented, okay? So now, we've completed the first 5 steps. We're in compliance with the HIPAA security rule. Now we need to test and see if our system works. So you think of this as a fire drill done on a quarterly basis, okay? Through this process of testing, your plan, your strategy, it's going to improve. Your tactics are going to become more efficient. You'll lower costs. You will improve your plan, all right? And most importantly of all, you're going to save your organization from a potentially devastating fine and embarrassing press, right? You don't want to be the next victim on MSNBC. Okay, so as you can see, HIPAA security compliance, it's really becoming a board level conversation, and all companies should be having this conversation. So now you have a game plan, okay? You have a roadmap to comply with this HIPAA security rule, okay? Like I said, it is very easy, okay, to understand the concepts. It's time to execute. These 6 steps will help you to avoid becoming a victim, right? My team and I, we're here to assist anyone who needs help developing their game plan. If you need more information, putting in all this together, you see my contact information on the screen there. And with that, we are going to officially wrap up this webinar. Thanks for coming out. I hope you RSVP for next week's webinar, where we will be discussing step 2, administrative safeguards. Have a nice day, everyone.